Welcome to Fibromyalgia Talks. I am your host, Necie Edwards, and this week we've been talking about managing chronic illness in the workplace. And today I bought some tools that I use to manage fibromyalgia that I want to share with you and educate you about these tools. So the first thing that I have here is a TENS unit. This TENS unit, you'll see here, there's the electrodes that I can place them on certain parts of my body. And as you can see, it's handheld. And there's different selections for pain. So there's one for back, where I can place these electrodes on my back. There's one for the hand and the wrist. There's one for low back, as well as hip pain. And then there's the shoulder and the knee. Now, this is a small device, but I'm going to tell you something. Is very, very powerful device. So it's kind of like if you've ever gone to a chiropractor and they've used electrical stimulation, similar to that, but I have one at my fingertips. So I've had this one for, I would say since I would say I've had this one now for a little bit over 3 years, and it's still working. It works very, very, very well. The next thing that I have is for sleep. So sleep is a real big problem when you have fibromyalgia or chronic illness, period. So this is called Deep Sleep Pillow Spray. And it helps you fall asleep faster and naturally. And this has lavender in it. And how I use this is I spray it just lightly on a pillow. I say lightly because when you have fibromyalgia or a chronic illness, when it comes down to sensory overload, I can't function well with loud scents or perfume. It just really puts me in overload, and then I get migraines. So you've probably seen this pillow on TV. My Pillow. You've probably seen a lot of their advertisement with My Pillow. I'm going to tell you, this is a small pillow. But this pillow, you ever bought a pillow in a store and you go to lay your head on it and then your head just sinks in where there's not much support? I had this pillow now for about 3 years, and you know what? It's still firm. It's outlasted other pillows that I've had. I like it because it's small and I can move it wherever I need it to be. So if you're someone who does a lot of travel for work, you know, maybe you want to take this with you to work to put in the back of your chair. You can put a little pillowcase over it. Or if you do a lot of traveling for work, you know, you can take it with you for your hotel room or the plane or whatever. But it's a very nice, comfortable pillow, and this is with My Pillow. Now, I have some other products here that I want to introduce you to today. And so, first of all, I want to tell you a brief disclaimer. I'm not a doctor. I'm not a nurse. These products that I have here are products that I have used that has been prescribed to me by doctors and physicians. Okay, so the first one that I have here is 5-HTP. These are supplements, and before you take any supplements, you know, you check with your physician to make certain that it's okay for you. So this is 5-HTP. This 5-HTP is good for sleep. So sometimes when I have problems with sleep, you know, I'll take 1 or 2 of these capsules, the 5-HTP at nighttime. Now, when I take the 5-HTP, yes, I'm still using the lavender. It's just an added benefit for sleep. Now, sometimes when you have fibromyalgia, you have a problem with adrenal fatigue, where, you know, you just feel even more just drained with your adrenals. So this is adrenal cortex. These are capsules. Next, we have cherry flex. These are red tart whole cherry soft gels. These are good for joint function and muscle fatigue. So I learned about this product from my chiropractor. And so cherries are also known to be good for reducing inflammation in the body. And so again, these are cherry flex. These here are soft gels. What I have for you here is Ginseng and Herb Co-op, their product. This is 100% Wisconsin American ginseng. So these are capsules, and all that's in here is the ginseng root. I learned about this product when I was at the Mayo Clinic. The Mayo Clinic prescribes this to a lot of their cancer patients. I do not have cancer, but even though I am not a cancer patient, the doctor prescribed it because it helps give you energy. Don't take it at nighttime though, because it's going to make you feel a little bit too wired. You take this during the daytime. And again, this is 100% Wisconsin American ginseng, and I purchased this at the Mayo Clinic. And this is really great for helping with their energy, because when you have fibromyalgia, especially CFS, chronic fatigue syndrome, you just feel so drained and exhausted all the time. And so this is good to lift you up, to give you some energy. What I have here is Fibroplex. Okay, this is a product by Metagenics, and these are good for soft tissue tenderness. And so this is a good product to take. These are not capsules. These are tablets. And I learned about this product also from my chiropractor. And so a lot of people with fibromyalgia, they do use the Fibroplex. So what it does is it helps takes the edge off of that. These are not opioids, because I don't use any opioids, okay? So these are supplements, but as with anything, you check with your physician to ask them, do they feel that this would be a good product for you to use? Now, this is my big Fibro Pack for fibromyalgia as well as chronic fatigue syndrome. So this here is the CFS Fibro Pack. And I'm going to show you what this looks like. Okay, so there are a total of there's like 4 different pills in here. Okay, and they each do something different. So, for example, this, if I'm not mistaken, I believe this may also have, one of them may be for vitamin D. One is good to help reduce the inflammation. One is good to help promote energy, but it's a Fibro Pack. And so with it being a Fibro Pack, and excuse me, but I don't remember all the others, what the others are that's in here, but it's a Fibro Pack. And you take one of these, the entire pack. And no, I don't take all these in one day. So you have to put together your own treatment plan for you. I've been dealing with fibro now since 2014, so I'm very good at managing my health to know what my body needs. So today, for example, I'm having a really bad fibromyalgia flare. Sometimes you get fibromyalgia flares due to the weather. Sometimes, especially if it's too hot or if it's too cold, the changes in the weather with the barometric pressure, all those things do affect your pain. The other thing too is if I overdo it and I don't pace myself during the day, then I pay for it later. So right now, I'm having a lot of pain. You may not can look at me and realize that I'm in pain. That's why fibromyalgia is known as the invisible disease, because if I was someone in a wheelchair or I had a cane or a walker, and you would look at me and you would say, okay, that person probably has some health challenges or is disabled. When you have fibromyalgia, you can't look at us and tell that we're in pain. If we tell you we're in pain, that's one thing, but by and large, you really don't know. That's why they call it the invisible illness. And having a really bad flare, I'm hurting so bad today that even my feet hurt really bad. And so what I'm wearing today is a brand of tennis shoes with Brooks, B-R-O-O-K-S. And Brooks is tennis shoes that was recommended to me by my podiatrist. And with these Brooks tennis shoes, the brand that I'm wearing is the Ghost, G-H-O-S-T. It feels great because the Ghost gives you all over support for your entire foot. They have one that's the Glycine. The Glycine is more or less for heel support. So sometimes, ladies, when you're hurting really, really bad and you can't have your feet in those heels and you need some added support, you really need to get a pair of these. You can find them at your local athletics store. I purchased these at Dick's Sporting Goods. They're maybe about $130 to $135, but they're well worth it. So these are just some of the products that's in my pain toolkit. The reason why I'm bringing this out today is because we're all unique and that we may need different things. So in addition to these things, I also have essential oils that I use. I use a lot of lavender. I may also use frankincense. I mean, there are so many different products that I use. Sometimes I just use old-fashioned products that you probably already have in your home, such as a hot water bottle. You can use a hot water bottle and wrap it in a towel, place it where it hurts, neck, shoulder, back, whatever it is for you, but wrap it in a towel just to protect your skin so that you don't get a burn. And sometimes that feels really, really good to help level down that pain. Another thing that I use that many of you may have is magnesium. So if you're going to the store, the magnesium, such as Epsom salts, for example, you know, you can put Epsom salts in your bath water, but now they have the Epsom salts with lavender together. You can put that in your bath and just take a nice deep soak in that, and that feels so good. In the area, we have in Illinois, we have places that have what they refer to as flotation tanks, where they have medicinal grade magnesium, and they're float tanks. You go in there and you can have on your bikini or your bathing suit or whatever, and you're just basically laying on top of the water. You're not even going into the water. The high grade of the magnesium keeps you buoyed up on top of the water and is really great for just relieving stress and tension. Other things you can consider using is there are some salt caves in Illinois, places where you can go where they have medicinal grade salt that's really good to help with the inflammation in the joints. I think there's this one place called Tavus. I may not be pronouncing them correctly. I believe there may be in the Glen Ellen area, Tavus, but it's a salt cave room where you go in there, you sit in chairs, and they have the salt that's supposed to have a lot of medicinal properties. That may be something that you want to check out for yourself. As far as the flotation rooms that I mentioned, there are float places in Illinois. There's also flotation tanks even in the Milwaukee area. I mean, there's just so many different things that you can do when it comes down to managing chronic pain. So one thing that I'm looking at doing this year for 2018 is I would love to put together, you know, a tour where maybe we all get on one bus where we can just go to different hot spots, you know, these really cool places to learn about the services that they provide, whether it's a flotation tank, whether it's a salt room, just different places where you can learn about your body and what's available out there that can help manage your pain. Think about it. These are all, you know, these are all holistic. The flotation tank, the salt room, different things, the essential oils, different things that you can do that's holistic, that's not an opioid, that's not an injection, just different things that you can do to level down that pain. Another thing you can do is warm water pools. There are in Lake County and parts of Cook County, all over the state and other states as well. They have what they refer to as warm water pools. So with the warm water pools, it's different from your regular pool. You get in the warm water pool, you can do aerobics in the warm water pool, and that really helps when it comes down to arthritis, joint pain, or whatever it is. I have a friend that she loves to swim, and she gets in the pool and she swims, and that helps her joint pain. I mean, there's just so many different things you can do. My not-for-profit, Fibro Patient Education and Support, we're actually planning a retreat for May of 2019 where we're going to be having different speakers and where we're going to be educating on things you can do to help manage your chronic pain. We had Joseph Freeman, who's a pharmacist in the, I believe, Buffalo Grove area. He was here maybe several weeks ago, and he was talking about another aid to managing chronic pain. He talked about CBD with the THC, or CBD without the THC, or medicinal marijuana. So many people, they do use CBD. So there's just so many different products out there that you can use to manage your chronic pain, because the goal is for you to figure out what's going to work well for you. You need to have a plan. Now, for me, I don't take prescription drugs for my fibromyalgia. The reason that I don't is because, number one, they have so many different side effects. I mean, whether it's Lyrica, whether it's Cymbalta, I mean, there's so many out there on the market that I'm going to tell you, sometimes those side effects just not worth it. It just makes you feel even worse. So you have to figure out what your body needs. Now, I'm going to tell you a really cool tip that I do that really helps me take my mind off of when I'm having a really bad flare, or if I'm feeling depressed about something or whatever it may be. A couple of things. One, first thing I'm going to mention that always works for me, prayer and worship. After prayer and worship, I recommend that you learn about meditation. There are many places that you can go where they have meditation rooms, where they can educate you on meditation. There are some chaplains that also provide education on meditation. In addition to that, get into arts and crafts, because art can be very healing. It can be very therapeutic. You've probably seen in the stores a lot of those adult coloring books. If you don't want to do the adult coloring books, how about just get into art? You know, painting, for example. I mean, there are so many different things that you can do. What I've started to do that has worked well for my chronic pain is I've learned a lot about Tai Chi. I'm now a certified chair Tai Chi instructor, and Tai Chi works wonders for me because those slow, gentle movements, number one, it helps me really sleep at night, and it just tones down the chronic pain. In addition to that, one thing that I do that I think is a lot of fun, that really just takes my mind off of everything, is you can do this using your iPhone. So I'll go into nature, forest preserves, or whatever, you know, I may feel like driving that day, have my iPhone with me, and I snap pictures of nature. And just being out in nature, experiencing that firsthand, the sights, the sounds, the smells, it's so relaxing. Consider it. Give it some thought. I know that College of Lake County, here in Lake County, Illinois, they even offer a photography class where they would teach you how to use a camera. There's even photography clubs. I mean, these are things that you can do that's holistic, things to take your mind off of whatever it is that's ailing you and whatever it is that's stressing you out. Another thing you can do is drive on out to the Chicago Botanical Gardens. Again, whatever works for you. The goal is to, number one, develop your own treatment plan. The doctors will give you a treatment plan. That treatment plan may be, okay, go to physical therapy. It may be take 2 of these pills, injections, or whatever it is. I'm talking about you developing your own holistic pain management toolkit, okay? Your own holistic pain management toolkit. If you're in tune with your body and you listen to it, it will tell you what you need. So for example, if I'm overdoing it, my body will let me know, Necie, you need to sit down. You're overdoing it. If you find yourself getting stressed out, your body will tell you, okay, you need to sit down, you need to unwind, you need to relax. Another thing that I also need to mention is when it comes down to your pain management toolkit, is also the foods that you eat. Try to always eat organic when possible, okay? Grass-fed, not grain-fed, grass-fed foods, okay? Think about what you're ingesting. Think about what you're putting into your body. So when you eat a lot of fast foods, those cooking oils that you're preparing your foods in, They could be GMO, genetically modified, that may be creating more inflammation in your body. So give it some serious thought about the foods that you're ingesting. Just like you see here, I have this little mini notebook. Start jotting down what you eat each day. Look at that. So after the end of each week, start noticing how you're feeling. Start paying attention, or even daily. Okay, let's say today you make a note of everything you ate, the time, what you ate, so that when you start not feeling so well, or you've noticed you're getting added headaches, stomach cramps, or whatever it is, you have a guide here that will give you an idea as to what it was that you ate. This matters because this will also help you zero in on foods that you need to avoid. There's also some tests out there that you can take, food sensitivity tests, that will let you know which foods that you are allergic to. I have invested in some of those tests, and I'm not talking about the tests for allergy testing that you can get at your physician's office where they can bill your insurance. These are more advanced tests that you can get. A lot of the functional medicine doctors have access to these tests, but these are tests typically sometimes it's not covered by your insurance carrier. I have had some people tell me that Blue Cross Blue Shield may possibly cover some of these advanced tests, not necessarily Aetna, UHC, and other carriers may not. But these tests are far more advanced. They're going to tell you exactly which foods to avoid. I mean, there are so many different specialized tests out there. I have had some of them done, and they're not cheap. They can be pricey. I've had some that was $300 one test, but they are out there. It just depends upon just how much information you want to know, how far you're willing to drill down to get the information that you need. But food does play a role with this. It's vitally important that you pay attention to what you eat. A friend of mine, her name is Cheryl Meyer. She's also known as the Health Muse. And she wrote a book on, how to, no, it's dealing with feeling better. Please forgive me, I can't quite think of the name of the book, but she wrote a book. She's known as Cheryl Meyer. She's known as the Health Muse. And I believe it's called It Feels Good to Feel Good Again. But anyway, this is a great resource. You can Google it. You can go on Amazon. It's a great resource because she's dealing with inflammation and toxins. And she's someone that has an autoimmune condition. And she's learned how to improve her health all through nutrition in terms of what you eat. And I'm going to take it a step further. Sometimes, in addition to paying attention to what you're ingesting, you need to pay attention to what you're also putting on your skin. Because there are certain lotions and different products you may put on your skin that may be also creating an allergic reaction. In addition to what you put on your skin, going back to what you're ingesting, there are some people who do better on a gluten-free diet. There's others that are able to eat gluten and they're still okay, but how we each respond is different. So my goal for you is that as you watch Fibromyalgia Talks, that you get more familiar and become your own health detective. So when you're a health detective, some people refer to me as the health detective or the health activist, but when you become your own health detective, you become more in tune with your body, what your body can handle, what it can't handle, okay? Toxins in your foods, toxins in your work environment, toxins in your home. I mean, it's just so many things that we need to just cut out of our life. Toxins are unhealthy. The food you eat does matter because you want to eat clean. So when we say you want to eat clean, we're talking about clean eating represents making certain that there's no antibiotics and there's no hormones in the food that you're eating. Also, you want it to be GMO, genetic. You want to make certain that you're staying away from GMO. So you want foods that is not genetically modified. You're going to notice on a lot of packages now, they will say that their products are GMO free. And that makes a difference because if you're eating a meat that's genetically that has GMO with it, or I should say foods that have GMO with it, they're going to have other toxins in there that's not going to be good for your body. There are some meats that they're now trying to clone. I mean, there are so many things out there that you need to be aware of. So I hope you've enjoyed today's show on how to manage chronic illness in the workplace. And if you want to learn more about any of these products, reach out to me for a list. I'll be more than happy to assist you. And I can be reached at info@fibromyalgiatalks.com, or you can reach me at 224 area code 225-9478. Again, 224-225-9478. Thank you so much for tuning in today's show. I hope you've enjoyed it. Have a wonderful day. Thank you.